My name's Jane Foreman. I'm the admissions tutor for midwifery at Kingston University.
I'm Padraig. I'm studying adult nursing here at Kingston University.
We select our nursing and midwifery students really carefully. We look to make sure you meet our entry requirements.
With Kingston, they kind of focus on your personality and what kind of person you are, which is kind of the most important thing for nursing.
We really are looking for those exceptional students. So when we're looking at your personal statement, we look at what sort of person you are, what you've done with your life, what transferable skills you can bring into health, which there is quite a few.
So at the start, you just walk in and you give your proof of identification.
So we ask you to come sort of mid-morning normally, and you'll be greeted by either myself or the nursing admissions tutor, and we sort of do a presentation where we really tell you a bit more about the job and what it's like.
After that, you about half hour break, and then you're back and you do interviews, 3 stations for about 10-15 minutes.
We ask a sort of general icebreaker at the beginning, so everybody will be asked at the same time about what they really understand the role of the nurse or midwife is. And then after that, it leads on to the MMIs.
So the multi-minute interviews, they're only a couple of minutes long, but it's in a very relaxed environment. So it's just like having a cup of tea or a cup of coffee with your lecturer. And it's a very handy thing because you get to know your lecturers from an early start.
They're really designed to strip out any privilege, if you like, so they don't disadvantage people with learning disabilities or dyslexia. It's nothing to do with where you're from or what school you went to or your educational or cultural privilege. It's really about the values and what you're really like as a human being.
The interview process is very relaxed. At the start you'd be a bit nervous, but once you get into the swing of things, everything kind of calms down. At one station now we are given a scenario. One station then you are asked why you want to go into nursing.
One example would be with a role play of an actor where you were looking after your little old lady next door neighbour's Padraig, but you were a bit careless and you left the window open and the budgie flew out of the window. So the role play as the actor will be the little old lady coming to collect her budgie, and we see how empathetic you are and how you communicate the bad news. Each of our interviewers will fill in the marking grid as you go from each station, and then we add the marks up and offer to the top performing candidates on those days.
I just say enjoy the whole experience that you can, because you won't enjoy another experience like this again.
Although it seems really scary, everyone there on the day wants you to succeed, so try not to be too nervous.
So I'd say best luck to anyone who's going doing their interview. Care, compassion and communication will take you a long way in your career.